Okay, so my phone ran out of storage, so I had to use his phone to video. So we left off on the cardiovascular system, and we were identifying the landmarks. So I was showing where the suprasternal notch was, and then I was pointing to the angle of Louis. So down below the suprasternal notch, you just glide your finger, and where you feel that V is the angle of Louis, and that's where the second rib starts, and below that would be the second intercostal space, or in between. So now we're going to move on to inspection. So I'm going to be just checking for cardiovascular distress, make sure that he's not having difficulty breathing, any chest pains, fatigue, a cough, edema, nocturia, which would be frequent urination at nighttime, and then make sure that he's not pale, his color is good. So inspect. He looks pink in color. It doesn't look like he's having difficulty breathing. Are you having any fatigue or chest pains?
No, ma'am.
Okay, so now we're gonna move to, I'm gonna have him lay down, so go ahead and lay down. And we want his head to be tilted a little bit at a 30 to 45 degree angle. So here's a pillow for you. All right, so I'm gonna be checking his JVD, or his jugular veins. I'm just going to make sure that they are not pulsating too hard or coming out too far. They should only be coming out to 1 to 2 centimeters, just laying there normally. So I'm going to check for that. So let me see here. Just look up. Okay, and his jugular veins seem to be fine. They're not like pulsating out or anything. If they were, that would be an abnormal finding. It could indicate that he has fluid overload or chronic heart failure. It just wouldn't be healthy if it was coming out like that. So now we're gonna move on to the hepatojugular reflex, which is I'm just gonna push on his liver and hook my fingers in the upper right quadrant where his liver is positioned, and when I push on it, it should displace the fluid back into his venous system, and it's gonna make his veins kind of come out further. But as soon as I let go, after 10 seconds, it should go back to normal, to the 1 to 2 centimeters, just normally pulsating. If it stays coming out more than regular, then that could indicate a problem. So it shouldn't stay lifted. So we're gonna go ahead and do that. So hook my fingers and push into his liver for 10 seconds. Can you see me? Wait, look up. I'm gonna look at your jugular. And his jugular veins, I saw them pulsating 1 to 3 centimeters out. So, and as soon as I let off, they went back to normal. So that's good. Now I'm going to be checking the apical impulse. That's in the 5th intercostal space, mid-clavicular line, so in the middle of your clavicle down. I'm going to use my finger to feel the gentle tap, and there should be no lifting or heaving because that would be abnormal. So I'm going to put my finger on the 5th, so 2nd. Okay, and I feel a gentle tap, so that's normal. And it should be 1 to 2 centimeters in size, half of systole. Next, we're gonna palpate over the precordial area. I'm gonna use the palmar surface of my hand, and I'm gonna start on the left side over the apex, and then I'm gonna move up on his sternum and then back over. That's just kind of the way the heart goes, so you're checking for all the different areas of where the heart's located. So go ahead and sit up for me so I can show them.
Face in which way?
This way. Normal. Okay, so you start at the apex, and I feel there. Move up and back over. And we're just checking again that there's no heaving and that his heartbeat is regular. Okay, so just move upwards. And we're checking for thrills as well, so I didn't feel any of those. Now we're going to identify the auscultary areas. So I'm going to use the diaphragm of my stethoscope, and I'm going to be checking first the aortic, which is on the right side, mid-clavicular line, second intercostal space. Okay, so aortic, and then we're going to move on to pulmonic. Pulmonic is left second intercostal space. So we're going to move over and listen there. And then slightly down is Erb's point. And then tricuspid, which is the fourth intercostal space, and it's slightly down from the from Erb's point. And then last, mitral, which is going to be in the fourth or fifth, or in the fifth intercostal space, mid-clavicular line. Okay. And the whole time I'm listening to make sure there's no murmurs or any thrills or abnormal heart sounds. Okay, and then I'm going to do the same on those auscultary areas with the bell to check for murmurs. Okay, and I didn't hear any murmurs. Okay, and then, okay, but murmur, okay, so we're listening for S1 and S2 sounds as well, which the S1 is in the tricuspid area, and then the S2 would be in the aortic area. So, let's see. We're going to listen for S1 in the tricuspid, which is right here. Oh, wait, it's right here. And then S2 is in the aortic. Okay. And then next we're going to feel for the carotid pulse with 2 fingers while we're listening to the heart, because it should simultaneously correspond the pulse and the heartbeat. They shouldn't be like 2 different patterns. They should be going together. Okay. So I'm gonna use 2 fingers and feel each carotid pulse, as well as listening to the tricuspid. And they were going together. They coincided, so that's a normal finding. And then next we're going to auscultate for bruits. I'm going to use the bell on the carotid arteries, and there should be no loud whooshing sounds because that would indicate a bruit. Bruits are just blockages in the arteries. So we're listening as well for any splits, murmurs, extra heart sounds while we're listening for bruits. Okay, and I didn't hear any whooshing sounds. All right. And the S1 sound is always systole, and then S2 is diastole. And then we were checking for if there was any tachycardia, which would mean his heart was beating irregularly fast, and or normal sinus, which it all sounded normal, so he had normal sinus. So now we're going to move on to the peripheral vascular system. I'm going to start with inspection per usual. I'm going to be checking his upper and lower extremities, making sure there's no scarrings, any wounds, swelling, that the color is pink in color, it's not pale or blue. So everything looks normal. I don't see any cuts or wounds, and his color is good. His symmetry looks normal. So now we're going to move on to the 4 T's, which is temperature, texture, turgor, and tenderness. For his temperature, I'm going to use the dorsal side of my hand to check for that and make sure he's not too hot or too cold. He's not moist or clammy. So my hands are really cold. And he feels normal in temperature. He's not too hot or too cold. Then we're going to go to texture. So he should be smooth. He shouldn't be scaly. He shouldn't be moist. He should be, just regular skin texture. So doesn't look scaly. Now turgor, we're going to move that. Turgor is just when you pinch the skin. So I'm going to check his upper and lower extremities. And it should snap back. If you have an older patient, sometimes they lose elasticity in their skin, so it won't snap back as fast, but you just need to know the baseline for each patient by their age and everything. So I'm going to check for that. So let me see your arm. And when I pinch it, it should go immediately back, or that could, if it doesn't, it could indicate dehydration. Okay, and check his leg. Okay, and it goes back. And now tenderness, make sure that there's no tenderness anywhere. So, do you feel any tenderness?
No, ma'am.
Okay, no tenderness. And now we're going to be palpating and comparing pulses bilaterally. So we're going to be doing all of the pulses bilaterally except for the carotid. Those have to be done individually. So we're going to go ahead and do that. So we're going to start with temporal. And it should be even on both sides. And I'm just using the two, my 2 fingers. Okay, and now we're going to go to carotid. Okay, oh yeah, do it individually on each side. Okay, and now brachial, which is on the ulnar side. And then we're gonna move to radial, which is the thumb on the wrist, on the thumb side. Okay, and now femoral. So femoral is just by the groins. And then popliteal, which is underneath the kneecaps. And dorsal pedis, which is on the top of the foot, in between the big toe and second toe. You're just going to feel right where that bone meets. Wait, can you put your foot up? Okay, right there. Oh, we need to do it at the same time. Let me see your other foot. Okay. Okay, and then lastly, the posterior tibial, which is going to be on his inside of his ankles. Inner ankle below the tibia. And some of these are a little hard to feel, so they're like a 1, especially down here. Okay. And now we're going to do the Allen's test. The Allen's test, I'm going to block off his ulnar and his radial artery on one hand, and he should lose feeling a little bit and have tingling and paleness in his hand. And then I'm going to release on the ulnar side of his artery, or his ulnar artery, I'm going to release. And if he gains feeling back in his hand and color, then that indicates that he has patency in his ulnar side. So that's what we're checking for, is patency. So let me see your hand. And block this off. Wait. Okay, now tell me if it starts to tingle at all.
A little bit.
Okay, now I'm gonna let go. Okay, and I noticed his hand was more pale when I was holding on to both sides, and when I let go, it regained color, pinkish color. So that means he does have patency in his ulnar artery. So now we're gonna do capillary refill on his upper and lower extremities. I'm just gonna pinch his finger and pinch one of his toes, and it should lose color, and then when I release, it should immediately go back to being pink. So let me see your finger. Okay. Now let me see your toe.
Oh no.
Your sock off. His toe is purple.
It's cold.
It's cold. Okay, and he has good capillary refill. Now we're gonna move on to the abdomen. So I'm gonna have him lay back down. And I'm gonna identify the landmarks on his abdomen, which is, you always wanna go upper right quadrant, and then lower right quadrant, and then upper left quadrant, and then lower left quadrant. So first I'm gonna inspect. I'm gonna look at the color of the contour, make sure it's symmetrical. You want it to be flat, you don't want any bulging or asymmetry. So it looks like he has symmetry and normal color and texture. Now we're gonna go to, okay. And also when I'm inspecting, I'm looking for catapit medusa, which is just spidering of the veins from the belly button, which can happen in pregnant women, but it doesn't look like he has any veins on his stomach, so he doesn't have that. Now, and then also I'm gonna have him go ahead and cough for me. Okay, and I'm checking for hernias when I have him cough, make sure that nothing bulges out whenever he does cough. So now I'm gonna auscultate the diaphragm. I'm listening for bowel sounds. If I was to not hear any bowel sounds, that would be an abnormal finding, but it would only be abnormal if it was after 5 minutes exactly. So if it did happen like before 5 minutes, but it was a little late or delayed, that would just indicate hypoactive bowel sounds. So I'm gonna start in the upper right quadrant. I'm using the diaphragm of the stethoscope. Lower right quadrant. Upper left quadrant. I heard a stomach growl. And lower left quadrant. Okay, and growling sounds and stuff like that, and like digestion is normal. Those are called borborygmy, I think. And then now we're gonna be auscultating for vascular bruits. I'm gonna use the bell for this, and I'm gonna be checking for the first spot is gonna be the aorta, which is right above the belly button. So I'm gonna listen for that. So the aorta. And then the renal artery, which is going to be out and down from the aorta on either side. Okay, and then the iliac, which is going to be out and down from the renal.